Andy Johnson. This is part 2, another video looking at substance abuse disorders or substance abuse with adolescents. Now, there are some risk factors that put a person more at risk to abuse a substance. It doesn't mean it causes this, but it puts them more at risk. And you can see these: lack of parental supervision, the availability of drugs, poverty, association with peers, drug abusing peers, most robust with adolescents, and then family conflict and those sorts of things. Substance abusers have also reported high rates of physical, sexual, and or emotional abuse. They live in violent or disorganized neighborhoods, and this puts a person at risk. It doesn't cause a person to abuse a substance. There is also frequent psychiatric diagnosis. This is called comorbidity. That means there's a substance abuse issue, but there may also be a mental health issue, an anxiety disorder or a depressive disorder, or some other mood disorder. Education level is also associated with illicit drug use. As the education level goes down, you can see it right here, the percentages of those who abuse drugs go up. Now, we don't know if this is a cause or effect. If the population tends to use more drugs, we don't know. Causation does not infer, or correlation does not infer causation. As I said before, mental illness and substance abuse is higher than the general population. That's that comorbidity. To show you some facts, ages 12 to 17, those with a major depressive disorder diagnosis that used illicit drugs, 34% to those without, who had 16. With a depressive disorder, depression, who meet the criterion for drug and alcohol dependence, 16, as compared to 5% who don't have depression. So that's that comorbidity. Now, a diagnosis. The DSM-5 looks at 10 categories of drugs to which individuals may have substance abuse disorders, and you can see them there, but we are concerned with alcohol and cannabis. Those are the two that adolescents tend to abuse the most. All drugs that are taken in excess directly activate the brain's reward system. So it affects the reinforcement of behaviors. Motivation is affected. So normal activities may be neglected, and we talk about how that affects the dopamine receptors in the brain. Now, for adults, to be considered to have a substance abuse disorder, only 2 of the following 10 things need to occur within a 12-month period. And keep that in mind. If 2 of these occur, then by definition, you have a substance abuse disorder. The substance is taken in larger amounts over a longer period of time than was intended. Persistent desire or unsuccessful effort to cut down or control the substance abuse. A great deal of time is spent in activities to obtain the substance abuse, to use the substance, or to recover from its effects. Craving or strong desire to use it. Reoccurrent substance use results in a failure to fulfill major roles or obligations at work, school, or at home. Again, any 2 of these continue to use the substance despite having reoccurring social or interpersonal problems caused by the effects of the substance. You continue using it even though bad things happen in your social and interpersonal life. Important social, occupational, or recreational activities are given up or reduced because of the substance abuse. You don't do it because you are focused on that substance. Recurring substance use in situations in which it is physically hazardous. And here is that: driving while under the influence. And the substance use is continued despite knowing that there are reoccurring physical or psychological problems. You know bad things are going to happen, but you continue to use it. And again, any 2 of these. And the last one, you notice a difference in tolerance. There's a need for increased amounts of the substance to get intoxicated, or a diminished effect with continued use of the same amount. So it doesn't have the same effect. You habituate towards the substance. And again, it is a disorder if any 2 of those occur over a 12-month period. So, treatment, and as teachers, we are not concerned with treatment. That's a little bit out of our wheelhouse. But think about this. Treatment for adolescents, they teach them how to cope, function, and socialize without drugs. Now, if that were part of our middle school and high school curriculums, we might prevent some of this, teaching them how to socialize, how to function interpersonally between and intra. That means dealing with emotions and social situations. The counseling is used to build self-esteem, establish social skills, education, and job training. Now, in our schools, our curriculums, we can teach social skills. We can't expect students to know these things automatically, and we can create curriculums that focus on self-esteem. Self-esteem is related to achievement as well. And here's the thing, if including this in our curriculums helped only one kid in 100 years, wouldn't it be worth it? Think about that. Substance abuse, looking at adolescence.